All right, welcome back everyone to another explainer. So, right now, global health authorities are on absolute high alert. A deadly virus is once again spreading across parts of Central Africa. Today, we're cutting through all the noise and breaking down exactly what you need to know about the 2026 Ebola emergency. No fluff, just the facts about what's actually happening on the ground.
Let's kick things off with a number that really puts the stakes of this crisis into perspective. 600. That is nearly 600 suspected cases of the virus as of just this week. And tragically, tied to those are about 139 suspected deaths currently under investigation. It's a heavy toll. We're also seeing dozens of frontline healthcare workers getting infected and, well, authorities actually fear the true number of infections might be quite a bit higher.
Here's how we're breaking it down today. First, the 2026 Ebola emergency. Second, understanding the specific Bundibugyo strain. Third, the WHO's global response. Fourth, prevention, treatment, and vaccines. And finally, exactly why experts are so worried.
Section 1. The 2026 Ebola Emergency.
Okay, so the terminology being thrown around right now is absolutely critical. The World Health Organization has officially declared this outbreak a public health emergency of international concern, or a PHEIC. If you haven't heard that term, it's basically one of the highest international health alerts the WHO can possibly issue. Think of it as a massive red flag waving to the entire globe, signaling that we urgently need coordinated international action to stop a wider spread and mobilize resources right now.
And looking at the geographic spread, it makes total sense why that alarm got pulled. The suspected epicenter is the Democratic Republic of Congo. But, as we all know, diseases don't care about borders. We're already seeing a rapid cross-border spread right into neighboring Uganda. Now, what's really keeping health officials up at night is that confirmed cases have actually reached Uganda's capital city, Kampala. Moving from rural, isolated areas straight into a densely populated urban center, that literally changes the game and severely escalates the whole containment challenge.
So you might be wondering, how did this spread so incredibly fast? Well, according to the WHO, this virus was likely spreading silently, completely undetected, for weeks before it was officially identified. And during that silent period, health officials believe a major community funeral acted as a massive superspreader event. It just accelerated the transmission dramatically. And that, unfortunately, is what brings us to this week's sudden explosion of hundreds of suspected cases, bringing the whole crisis right into full view.
Section 2. Understanding the Bundibugyo strain.
Now here's a really crucial point. Not all Ebola outbreaks are exactly the same. The WHO has confirmed that this specific outbreak involves what's known as the Bundibugyo strain. This is a particularly rare strain of the virus, and historically it carries a severe fatality rate of somewhere between 30% and 50%. It's a highly lethal pathogen, no two ways about it, which completely underscores why the medical response has to be so urgent.
To really grasp the risk here, we've got to ground ourselves in solid facts, not fear. First off, Ebola is not airborne. It requires direct contact with the bodily fluids of an infected person or animal. So we're talking blood, sweat, vomit, or saliva. It can also spread indirectly, through contaminated surfaces or medical equipment. And just like we talked about with that superspreader event earlier, unsafe burial practices are actually a major driver of transmission.
But here's one of the biggest hurdles for doctors on the ground right now: early detection. Because early on, Ebola symptoms, like fever, weakness, muscle pain, a sore throat, they look virtually identical to common regional illnesses like malaria, the flu, or typhoid fever. It's like finding a needle in a haystack, making it incredibly tough to isolate patients quickly. Though there is one important caveat that WHO points out. People are usually not contagious until those symptoms actually start showing up.
But man, as the disease progresses, it diverges aggressively. Things get really bad. Patients can experience severe internal or external bleeding, organ failure, critical breathing problems, and ultimately shock. It's an absolutely devastating progression to witness, and that is exactly why early intervention is literally a matter of life and death for a patient's survival.
Section 3. The WHO's global response.
So, when assessing the broader global threat, WHO Director General Dr. Tedros made a really crucial distinction. He explicitly stated, the risk is high at national and regional levels, but currently low at the global level. So while the alert level is at its absolute peak to help mobilize resources, the immediate risk of a massive worldwide pandemic is currently low. That means we really need to keep our focus squarely on the very real, very present regional crisis happening right now.
The thing is, managing that regional crisis is proving to be incredibly difficult. The whole situation in eastern Congo is severely complicated by ongoing conflict and violence. As humanitarian conditions deteriorate, all this insecurity is actively fueling the outbreak. I mean, think about it. Healthcare workers simply cannot safely trace contacts. They can't isolate patients properly, or even transport lab samples across active conflict zones. The virus is essentially exploiting the region's geopolitical instability like a loophole.
Section 4. Prevention, Treatment, and Vaccines.
A massive challenge with this specific outbreak really comes down to a frustrating timeline, 6 to 9 months. Unlike some previous Ebola outbreaks where, we had targeted vaccines ready to deploy, there is currently no fully licensed vaccine specifically approved for this rare Bundibugyo strain. Now, experimental vaccines are in development, which is great, but the WHO estimates it's going to take a solid 6 to 9 months before they become widely available on the ground.
So you're probably asking, how on earth are healthcare workers saving lives without a vaccine? Well, the current medical response relies heavily on really rigorous supportive care. We're talking critical hydration, oxygen therapy, and aggressive symptom management. The overarching key here, the real game changer, is early medical intervention. If you can get a patient into a supportive care environment immediately, it drastically improves their chances of survival. It essentially buys their immune system the time it needs to fight off the shock and dehydration.
Now, on an individual level, the WHO has put out some pretty strict advisories if you're in or traveling near the affected regions. Step 1 is avoidance. Just completely avoiding contact with bodily fluids, absolutely not handling deceased individuals without proper protection, and steering entirely clear of bats and wild animals. Step 2 is rigorous hygiene, mostly just washing your hands frequently with soap or sanitizer. And Step 3 is immediate action. If someone develops symptoms after traveling to these areas, they have to isolate and seek medical care right away. Plus, authorities are strongly urging neighboring countries to really step up their border surveillance.
Section 5. Why experts are so worried. Tying this whole explainer together, what we're basically looking at is a convergence of some serious systemic vulnerabilities. The number one concern for experts is that delayed detection. Because this virus circulated silently for basically 2 months, there are likely many transmission chains that are just completely unknown to us right now. You combine that with the rapid cross-border spread into urban centers, the truly tragic loss of frontline healthcare workers, and the stark reality of having 0 approved vaccines for the next 6 to 9 months, it's a perfect storm. And it has epidemiologists deeply, deeply concerned.
Which really leaves us with some vital questions as we move forward. Based on everything we've uncovered today, should African governments step in and increase travel restrictions to try and choke out these transmission chains? And, looking at the much broader picture, are our global health systems actually any better prepared to handle this now than they were during previous Ebola outbreaks? I mean, the data shows we absolutely know what to do, but actually executing it in the middle of a conflict zone without a vaccine, that's the real test. I'd love to know how you guys interpret these systemic challenges. Thanks so much for joining me for this explainer. Stay focused, stay informed, and as always, keep learning.